University of Houston, Baylor, Texas A&M, and the University of Texas. As a standardized patient, Kathy provides oral feedback and written evaluations to medical students. She also, in addition to these duties, she serves as a patient for ultrasound exams and is an educational teaching associate for physical exams for first-year medical students.
Thank you, Francie, for that very warm welcome. And thank you for agreeing to be my medical student. And Francie also, she interviewed me and she came up with the PowerPoint presentation. So first we're going to do, yeah, good job, thank you. So first we're going to be doing a skit, and then we'll go through the PowerPoint, and at the end we'll have some time for questions, okay? Before we begin the skit, I'm going to read a disclaimer. Okay, so first of all, this is not a script from work, although it contains many of the same elements, but because of copyright laws, I developed this script myself. And for time's sake, it's much shorter than our actual encounter would be. And secondly, this skit is very exaggerated. So I do encounter all of these things, but not all in one encounter or to this extent. So the students are here to learn, and they do make mistakes, but of course they're not going to make all the mistakes in one setting. So for the most part, the students I work with, I just want to say, are truly brilliant. They're enthusiastic. I love working with them so much, and they are truly awesome. So I'm going to get prepared for this skit. Okay. Come in.
Good morning, Mrs. Q. What a beautiful day. I'm Angela Feelgood, a medical student here at the medical school, and I will be taking your history and providing a brief physical exam. How may I address you?
You can call me Susie.
And what are your pronouns?
Pronouns?
I mean, mine are she, her, hers.
Oh, they, them.
Awesome. So what brings you in today?
Oh, it's my stomach. It just really hurts.
Awesome. Well, that's no fun. Let's see what we can do. First, I need to ask you some questions.
Sure.
When did this begin?
Last night after dinner.
What did you eat?
Like some King Ranch chicken.
Cool. I love that. My mom has the best recipe for that. The secret is in the sauce. I could send that to you.
Sure.
Did anyone else get sick after eating?
No, no one did.
Awesome. Did you throw up?
Yes, just once, but I'm still really nauseous.
Yeah. What color was it?
Like a bright red.
Great. How would you rate the pain on a scale of 0 to 10, 0 being nothing, and 10 being like your stomach has exploded?
Definitely a 10. I've never felt this way before.
Awesome. Ever felt like this before?
I just said that. No, never.
Awesome. How about your family? Any history of stomach issues?
Not that I know of. My dad died when I was a baby, and I don't know what he died from.
Perfect. Do you smoke? Take drinks? Drink a bunch?
I drink.
Right. Do you have any medications that you're on?
No, not that I know of, no.
Awesome. Are you allergic to anything?
No.
Okay. You seem just fine to me, but let me ask you a few questions.
Okay.
Do you have headaches, depression, joint pain, shortness of breath, vision loss, hearing loss, heart palpitations, problems urinating, hair loss, congestion, cough, memory loss, sore throat, pain in the chest?
No, none of those.
Awesome. Well, I don't know what's going on, but let's have a look-see. First, I'm going to look at your abdomen. It appears you have dots all over it.
That's my gown?
Right. Okay, then let me just this in just a few more places. Okay. I'm going to have you do some sit-ups now. Just going up and down. Sorry about that, but no pain, no pain. Now I'm going to poke around a bit.
Oh, stop, please.
Does that hurt?
Yes, I've never felt anything like this before.
Okay. You'll be happy to know that I didn't find anything wrong with you, but I will give you a Tylenol to help with the pain. Come back in a few days if you don't feel better. Okay. Awesome meeting you. Have a fun day. Angela.
Angela, it's such a pleasure meeting you, Angela. Thank you for being here today. And we'll just take, like I said, take a few minutes, talk about how I felt as your patient, and maybe a little bit about the physical exam as well. So how do you feel like it went?
Okay.
Yeah, great. Okay, well, I did feel like you asked some very pertinent questions, so that did give me some confidence in your ability. Check my notes here if you don't mind a little bit. Okay, well, and I really did appreciate your effort to build a rapport with me by wanting to share your mom's recipe. It does sound delicious. So, but however, you know, since I was in such pain, I might have preferred a more serious tone, more focus on my stomach, okay? And, you know, along those same lines, you have such a cheerful demeanor, and in some cases that would be so welcomed. But again, in this scenario, when I'm in such pain, I think a more serious, concerned tone would be more appropriate, okay? So, you know, using words like awesome, cool, they might be a little bit informal for this situation. The faculty would prefer if you use more professional language as a soon-to-be doctor, okay? And those are great words, but, you know, I use them a lot myself among friends. But in response to my pain, when you were saying cool and awesome, and when I told you about my dad's death, I felt just a little bit dismissed and not heard.
Oh,
so,
I'm sorry.
See what you just did right there, saying, I'm so sorry, and nodding your head and your body language and your tone of voice. That was perfect. I would have felt really comforted if you had given that response. So just something to think about. So as far as the physical exam goes, I did appreciate when you were poking my stomach and I asked you to stop and you did. So thank you for that. However, I lost a little bit of confidence in your ability to treat me when you looked at my gown and you thought it was my abdomen. So remember, the faculty would always like you to inspect on skin and do all of the procedures on skin, okay? All right, so thanks so much again. Do you have any questions or concerns for me?
No, thank you so much.
You're so welcome. Thanks for being here, and I just want to wish you success in all your studies. Thank you. Thank you very much. Okay. Great. Thank you so much. Thanks for being here again. It's really a joy to be here. Thanks again, Francie. You were amazing. And you were awesome. That's right. That's what I say. Okay, so now the hard part is, okay, can you hear me okay? Yes. Okay, great. So now I'm going to share the PowerPoint presentation with you. I'll let you read off of it yourself. I don't want to just read and bore you to death, but But I am going to talk about each of the slides as we go through. Okay, let's see this clicker. Okay, Christian, I may need help. Let's see. I'm not getting it here. Technical difficulties. It's that, oh, there it went. Okay. Thank you for your patience. Right, the arrow?
Feel the dots on it?
Uh-huh. Okay, that's what yeah. I want to go down. Okay, sorry about that. I need to go down. Okay, and Francie already covered this with you earlier, the schools I work at, what my jobs are as a standardized patient, but I'm also a teaching assistant or associate for several of the schools, so I actually teach the physical exam. Okay, what does a standardized patient do? Well, basically, I'm an actor. I play the role of a patient, and those roles are so varied across the board. They're, I might have Ebola, all sorts of ailments, and all sorts of emotions that I have to portray as well. So I go in as a patient, and the doctors take a history on me, much more thorough than I just took. And then they perform sometimes a complete physical exam, sometimes just a partial, based on what my ailment is. So they have to kind of narrow that down. After the performance or after the encounter, I then give feedback, and one-on-one feedback. A lot of it's on interpersonal communication skills, and I try to get the student a little bit more engaged in the conversation than I did with Francie most of the time. But also I do written feedback. We have to fill out a checklist online and what they miss and what they need improvement on, and I make comments on that as well. Okay, and this is, I feel like, important work because it fills a gap between classroom teaching and instruction and being with a real patient. So it helps fill that gap so there's less risk to real patients when they get to those. Okay? Okay, let's see. About Kathy, there, you don't want to know about me anymore. Here. Okay, how does a standardized patient prepare? Okay, I am given a script, and I have to learn all the information. Now, I don't want it verbatim because the students ask different ways. You don't know how they're going to ask a question. Sometimes they ask questions that aren't even on the script. So then I have to kind of improvise a little bit and answer accordingly. Okay, but so I'm given a script. I practice that. We do say verbatim the opening statement. Everyone tries to be very standardized. And I practice it, and we're given training, so at least one training for cases, but sometimes multiple trainings, depending on the case and how involved it is. And we watch each other perform. We have a computer room, and I'm able to watch all my coworkers, which I get great information from. Some of them are actually actors that work here in town at some of the theaters, so they provide valuable information to me. And we role play with each other, and some of the cases are repeated monthly, but I always make sure I go back and I review because there's so many cases. Okay? How are the evaluation results communicated? Well, I've basically already talked about this. An online checklist, one-on-one communication, giving feedback. And one thing I want to stress is we try very hard to use I statements. When you did this, I felt this way. So, and as do you people, you're all very familiar with that, I'm sure. But because, the students work so hard, they want to be there, and so we really want to encourage them. We don't ever want to belittle anyone. Okay, what are the challenges? Ensuring standardization, so making sure we're all on the same page so that the students are getting the same experience. And we try to make it as authentic as possible. And I kind of mentioned this, students ask in different ways, and so you have to be prepared really know your information, become that character. Okay, and I work at 4 different schools, as Francie mentioned, and some of the schools, I mean, basically they all teach best practices, but some of them do have some different protocols and techniques. So every time I go to a different school, I have to remind each other, okay, today I'm at A&M, so I have to do it this way. And we remind each other because there are some of those instances. Also, telehealth conferences. During COVID, of course, we couldn't meet on campus. The students couldn't be touching me, so we went to Zoom and did telehealth. Some of those cases we've continued on Zoom, and that's kind of the wave of the future, so I feel like it's very important. I may have 6, 8 students come into the Zoom room, and they have to work together as a team. One plays the part of the doctor, the nurse, the administrator, whoever. But, and they really have to work to give you information as a team. So that's interesting. And also students are sometimes skittish about touching us. Also asking questions for the history, sexual history sometimes. They're very skittish about that. And then approaching our bodies as well. They're afraid to touch us. And so we teach draping techniques are very important, and ways to approach, certain parts of the body that they may not want to be touching, like your femoral pulse, or, you have to lift up your breasts to listen to the valves. So things like that. So we work with that. And of course, I've already said how to provide input in an effective way. Okay, how does the standardized patient position relate to social justice? Well, mostly providing constructive feedback to the students, talking about active listening, addressing the patients in a respectful manner. So we portray patients, different races, different socioeconomic backgrounds, different genders, and so, working with that, and from all different walks of life. So what are the rewards of this work? A couple of things I didn't put up here. One is it's just fun. Okay, I really enjoy it. And if you know me very well, I like to have fun. And it's just great. And also, I'm learning. There's something else I didn't put there, but I'm learning so many new things. And I love that. As a retired teacher, I know my dad said, you learn something new every day. And so I try to, and this is a great opportunity for me. Knowing just that, I'm doing a little bit maybe to help create better doctors. And the students are amazingly appreciative of us. Unlike maybe when I taught middle school, I loved it, but they weren't quite as appreciative. But these students are so appreciative. Every day they tell us, they tell their instructors. So they're really grateful for what we do. And my camaraderie with my coworkers. They're just all amazing. We all want to be there. We work together as a team. They've become like a second family to me. I've developed really great friendships with them. So it's very rewarding. And I think that concludes the presentation. So I'll go ahead and take questions now. Thank you. Okay, Susan, you take you first. Okay, great. Good question, Susan. So she was asking how often the students do this, and if they recycle, and if they're required. Yes, they are required to do this. I mean, their instructors set it up, and they do several SP cases. They do several encounters within a semester, and it does go into their second, third year as well. So it's something they get very used to. They take it very seriously. We try not to ever break character. Students every once in a while will and ask me like, well, what am I supposed to say next, or what am I supposed to do next? And I'm like, I don't know. You're the doctor. But yes, it is required, and they are tested over it. So we do exams as well. And we have raters watching in the other room, and they come help fill out the checklist. So, thanks. Good question. Marcella, you were next.
What was your ailment supposed to be?
For here,
What was your ailment
well,
supposed to
it
be?
was just stomach pain, but in my mind, it was probably, I was thinking appendicitis, but she didn't do any of the tests for appendicitis, so she probably wouldn't know that. And they don't know when they come into the room, so they have to develop a diagnosis and a treatment plan for me. Good question. Okay, Marcia.
How long has this program been in existence in Houston, and is this fairly standard all over the country?
It has spread. I'm not sure in Houston. I have some friends that have done it for quite a long time now, so I want to say something like the 80s, but I'm not really sure. So I'll get back with you on that, okay? Thanks. Yeah. And it is pretty much all over the country now. Yes, because I've met people other places, and they say, oh, yeah, I had a standardized patient where I went to school. And so it's pretty much spread. I'm sorry, Krell? Oh, you're so sweet. Thank you. Okay, Sherry.
You said you work for 4 hospitals. Are you employed by 4 separate hospitals, or do you have one employer that they work with?
Good question. Okay. Well, I'm an employee of UT. The others are basically more of a contract work. Okay. So they don't take taxes out of those. So I have to make sure I pay my taxes as I go along. But yeah, that's a good question. I started working at the chiropractic college in Pasadena, which was quite interesting as well. Okay, any other questions? Yes.
Hey, if I'm interested in doing this as a job, how do I get started?
Well, you can talk to me after this, and I'll give you some information. Also, you can just go online, just type in standardized patient, UT Medical School, Houston, Texas, or Baylor, or A&M, U of H. So, and I'm more than happy to talk to you about that. Okay. Yes.
You said there are different protocols at the schools. Can you give an example of like how different medical students would approach?
And things change a little bit from year to year as well. The students use Bates and medical book, and that's what they kind of go from. And it changes a little bit year to year for one thing. So, for example, doing peripheral vision. You know, before the student would get close to us, come from behind us and come up like this, you know, from behind us. And now they stand in front of us and they have to cover the opposite eye and go this way. So just things like that. And so some of the schools are still doing it the old way, some the new way, just different things like that. But any other questions? Do you want to know some of my favorite cases? Yes. That was the one question I prepared for. So, well, I played a whole lot of different cases. One time I was pregnant. One, I have a little baby I come in with that's sick. I've had a 10-year-old child before. And I was OCD one time. So, just a lot of different cases. But one thing I really enjoy is every year we do a disaster day. And so it's like UT and the medical school, the nursing school, and I think the dental school all come together. And it's just all day long. And there's a disaster. It might be a bomb, a shooter out in the parking lot. And so there's SPs out there with mutilage all over them and dripping blood. And they have to bring them in on gurneys to the ER. I'm in the ER usually with my husband, and he's a mannequin. But I push buttons, and he does different things, like says, and then if he gets the right medication, he goes, oh, that's better. So that may not be real authentic, but the thing is just to get that, chaos, and help them to see that they have to set their priorities and work together as a team. So it's really interesting, and it's a lot of fun. There might be someone running in the room looking for a relative, that they can't find. It's just, it's pretty neat. Anyway, any other questions? Are we good? Okay, again, thank you so much for being here. It was a pleasure. Thank you.
Thank you so much, Kathy, for being here and sharing with us. This was really fascinating. So we appreciate you and appreciate the work that you're doing
Thank
as
you
well.
so much. And I
Thank
really
you.
appreciate Francie and Steve, too, doing this art form.
All right, everybody, thank you all for coming.